These 9 common medications can damage your liver. Did you know that some of the medications you take daily can cause serious damage to your liver? Yes, those common meds in your cabinet might be harming your liver. And the worst part is, liver problems are often silent and only show symptoms when the damage is already done. Here's the worrying part. Certain medications, when used incorrectly or for long periods, can overload the liver and even cause serious damage. This happens because the liver has to metabolize the compounds in the medications, and some of them are more toxic to liver cells. Over time, this constant stress can lead to inflammation, fibrosis, and in more severe cases, even liver failure. Many of us take multiple medications daily without thinking about the possible impact on liver health. Also, most people don't realize how serious it can be until the symptoms are already advanced. In this video, we'll talk about 9 common medications that can damage your liver. You'll learn which meds these are, how they affect the liver, and most importantly, how to protect yourself and prevent liver damage while taking them. By the end, you'll have clear and practical tips for taking care of your liver health. First medication, antibiotics. Antibiotics are a widely used class of drugs for treating bacterial infections. They are highly effective in fighting a variety of illnesses, like respiratory, urinary, and skin infections. However, what many people don't realize is that some types of antibiotics can be harmful to the liver, especially when used improperly or in high doses. Among the antibiotics with the highest potential to cause liver damage are amoxicillin and erythromycin. These medications can trigger a condition known as drug-induced liver injury, DILI. DILI happens when the liver becomes inflamed in response to certain medications, damaging its cells. In severe cases, this can lead to jaundice, yellowing of the skin and eyes, liver failure, and in extreme situations, the need for a liver transplant. It's important to understand that not everyone who takes antibiotics will experience liver damage, but some people are more susceptible, especially those with pre-existing liver conditions or those taking multiple medications simultaneously. Prolonged use of antibiotics can also increase the risk. So, what can you do to protect your liver? First, avoid the indiscriminate use of antibiotics. Only take these medications when absolutely necessary and always under a doctor's guidance. Additionally, during antibiotic treatment, watch for signs of liver problems, such as extreme fatigue, abdominal pain, dark urine, and yellowing of the skin. If you notice any of these symptoms, seek medical attention immediately. Second medication, acetaminophen, paracetamol. Acetaminophen, also known as paracetamol, is one of the most widely used medications in the world for relieving pain and reducing fever. It's found in many over-the-counter brands like Tylenol, and many people trust it because it's accessible and effective. However, despite seeming harmless, acetaminophen can be extremely dangerous to the liver when used improperly. In fact, acetaminophen is one of the leading causes of acute liver failure worldwide. This happens because when taken in high doses or over long periods, it overwhelms the liver, creating toxic byproducts that damage liver cells. The liver can usually process small amounts of acetaminophen without any major issues. But when the dose is excessive, it can't keep up, leading to the buildup of these harmful substances. Early signs of acetaminophen toxicity may include nausea, vomiting, abdominal pain, and loss of appetite. If liver damage progresses, more severe symptoms like jaundice, mental confusion, and even coma can occur in the worst cases. The problem is that much of the damage may be irreversible if treatment isn't started quickly. The good news is that these risks can be avoided with a few simple precautions. Always follow the recommended dosage on the medication label and never exceed the suggested amount, even if pain or fever persists. Additionally, it's crucial to avoid alcohol while taking acetaminophen, as alcohol is also processed by the liver, increasing the risk of liver damage. Remember, even though acetaminophen is widely used, it's not completely risk-free. Stay alert to signs of liver issues and consult a doctor if you're using acetaminophen frequently. Third medication, non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, or NSAIDs, are commonly used to treat pain and inflammation. Popular NSAIDs include ibuprofen and aspirin, which many people take for anything from headaches to joint pain. While effective in relieving pain, these medications can pose a significant risk to the liver, especially when used for long periods or in high doses. When people think about the risks of NSAIDs, they often focus on the kidneys or stomach, but the liver can also be affected. Prolonged or excessive use of these drugs can lead to liver inflammation, known as drug-induced hepatitis. In some cases, this inflammation can result in more serious liver damage, such as liver failure. Individuals with a predisposition to liver diseases or those already taking other liver-straining medications are at a higher risk. It's important to be aware of the signs that your liver may be in trouble. Symptoms like excessive fatigue, yellowing of the skin, jaundice, abdominal pain, and dark urine can be warning signs of liver issues related to NSAID use. If you notice any of these symptoms, seek medical advice right away. So, how can you use NSAIDs more safely? First, never take these medications for long periods without a doctor's supervision. Also, make sure you're using the lowest effective dose for pain relief, and whenever possible, try alternative methods like rest or compresses before turning to NSAIDs. Regular liver function tests can also be a good idea, especially if you use these medications frequently. Fourth medication, statins. Statins are widely used medications to control cholesterol and prevent cardiovascular diseases like heart attacks and strokes. They work by blocking an enzyme in the liver responsible for producing cholesterol. However, despite their heart health benefits, statins can have a negative impact on liver health. Using statins can increase liver enzyme levels in the blood, a sign that the liver may be under stress or even damaged. This increase, known as elevated transaminases, is usually mild and temporary, but in more serious cases, it could indicate significant liver damage. Though rare, long-term use of statins at high doses can result in drug-induced hepatitis, a liver inflammation that could progress to liver failure if not treated. The good news is that liver damage caused by statins is usually reversible. When the medication is discontinued, liver enzyme levels typically return to normal and the liver recovers. However, this doesn't mean you should stop taking statins on your own. It's crucial to make any changes to your treatment under a doctor's supervision, who can adjust your dose or recommend liver function tests to monitor how your liver is responding to the medication. If you're taking statins, it's a good idea to have regular blood tests to check your liver enzyme levels. Also, watch for symptoms like fatigue, abdominal pain, jaundice, and dark urine, which could be signs of liver problems. Fifth medication, antifungals. Antifungals are medications used to treat fungal infections, such as athlete's foot, nail fungus, and even more serious systemic infections. Common antifungals include ketoconazole and fluconazole. While they are highly effective in combating fungal infections, these medications can also cause serious liver damage, especially when taken in high doses or for long periods. Like other medications the liver needs to metabolize, antifungals can put extra stress on this organ and cause liver damage. In more severe cases, prolonged use of antifungals can lead to hepatotoxicity, a condition where liver cells become damaged, resulting in inflammation and even liver failure. Some signs that your liver may be affected include fatigue, upper abdominal pain, jaundice, yellowing of the skin and eyes, and dark urine. Certain factors can increase the risk of liver damage when using antifungals, such as alcohol consumption, pre-existing liver conditions, and the simultaneous use of other liver-affecting medications. For this reason, it's crucial for anyone taking antifungals, especially for extended periods, to get regular tests to monitor liver health. If you need to use antifungals, talk to your doctor about the risks to your liver and the need for liver function tests. Avoiding prolonged use and sticking to the recommended doses are also effective ways to reduce risks. If you notice any symptoms of liver problems while on antifungal treatment, seek medical attention immediately. Sixth medication, methotrexate. Methotrexate is a powerful drug used to treat various conditions, such as cancer, rheumatoid arthritis, and psoriasis. It works by inhibiting cell growth, which makes it effective in treating diseases involving uncontrolled cell growth, like cancer. However, prolonged use of methotrexate can seriously impact liver health, making it one of the most well-known medications for its hepatotoxicity. Long-term use of methotrexate can lead to several liver issues, including liver fibrosis and even cirrhosis. Fibrosis is the buildup of scar tissue in the liver, occurring when liver cells are repeatedly damaged. If this damage continues, it can progress to cirrhosis, a a condition where the liver becomes permanently scarred and cannot function properly. Methotrexate's effects on the liver are cumulative, meaning the longer someone uses the medication, the higher the risk of developing liver problems. Symptoms of methotrexate-induced liver damage can be subtle at first, such as unexplained fatigue, nausea, abdominal pain, and loss of appetite. Over time, more serious signs may appear, such as jaundice, fluid buildup in the abdomen, ascites, and mental confusion, indicating liver distress. To minimize these risks, it's crucial to have close monitoring with your doctor, including regular blood tests to check liver function. Additionally, avoiding alcohol during methotrexate treatment is highly recommended, as alcohol further strains the liver. In some cases, dose adjustments or temporary breaks in treatment may be necessary to protect the liver. Seventh medication, amiodarone. Amiodarone is a widely used medication for treating cardiac arrhythmias, or irregular heartbeats. It is highly effective in regulating heart rhythm, particularly in people with atrial fibrillation or ventricular tachycardia. However, long-term use of this medication can cause serious liver damage. Amiodarone is known for causing hepatotoxicity, especially with prolonged treatment. This medication tends to accumulate in the liver over time, leading to inflammation and, in more severe cases, liver failure. Although not all patients taking amiodarone develop liver problems, those who do may experience symptoms such as fatigue, abdominal pain, jaundice, and liver enlargement, which can be detected through imaging tests. The liver damage caused by amiodarone can range from mild elevations in liver enzymes, often indicating some level of inflammation, to more serious issues like liver fibrosis and cirrhosis. In some cases, stopping the treatment may allow the liver to fully recover, but in others, the damage can be permanent. To prevent liver complications, it is crucial for patients taking amiodarone to undergo regular liver function tests, ideally every 3 to 6 months, depending on the length of treatment. Additionally, it's important to discuss any unusual symptoms that may arise during the use of this medication, such as abdominal pain or jaundice, with a doctor. Constant monitoring and dose adjustments are key to ensuring that amiodarone treatment remains effective without compromising liver health. Eighth medication, antidepressants. Antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, are widely prescribed to treat depression and other mood disorders like anxiety. Medications such as fluoxetine, sertraline, and citalopram have proven effective in relieving symptoms of these conditions. However, prolonged use of these medications can impact the liver, particularly in individuals with pre-existing liver conditions or those taking other medications that affect liver function. SSRIs can cause elevations in liver enzymes, signaling that the liver may be under stress or experiencing some degree of inflammation. While this increase is typically mild and temporary, in some cases it can progress to hepatotoxicity, meaning liver damage. This risk is higher in patients who use high doses of antidepressants over long periods or combine them with other liver-straining medications. Signs that the liver may be affected include extreme fatigue, loss of appetite, pain in the upper right side of the abdomen, nausea, and jaundice. If you are taking antidepressants and notice any of these symptoms, it's important to seek medical advice. Your doctor may order blood tests to check liver enzyme levels and determine if the liver is functioning properly. To protect your liver health while using antidepressants, it's essential to have regular blood tests, especially if you're on the medication for an extended period. Additionally, discuss any other medications you are taking with your doctor to avoid combinations that could put extra strain on the liver. In some cases, adjusting the dose or switching to a different antidepressant may be necessary to reduce the risk of liver damage. Ninth medication, supplements and natural medications. In recent years, the use of supplements and natural medications has become extremely popular. Many people believe that because these products are natural, they are completely safe. However, not everyone knows that some supplements can cause serious liver damage, especially when taken in high doses or for long periods. Among the supplements most associated with liver problems are kava, St. John's wort, and green tea extract. Kava, for example, is often used to relieve anxiety and stress, but can cause severe liver toxicity in some cases, even leading to liver failure. Green tea extract, although widely promoted for its antioxidant benefits, can be harmful when consumed in large amounts, overloading the liver and causing inflammation. St. John's wort, commonly used to treat mild depression, can also interact with other medications and increase the risk of liver damage. One of the biggest issues with supplements is that they are not regulated as strictly as prescription medications. This means that the dosage, purity, and even safety of many of these products can vary, increasing the risk of side effects, including liver injury. If you use supplements regularly, it's important to watch for signs that your liver might be affected, such as extreme fatigue, nausea, abdominal pain, and jaundice. To minimize the risk, avoid high doses of supplements, especially those known to be hepatotoxic. Remember, just because something is natural doesn't mean it's free of risks. Medical guidance and conscious use are key to protecting your liver health. Prevention tips. Protecting your liver is essential for overall health, and being mindful of your medication use can make a big difference in preventing liver damage. First, always talk to your doctor about the medications you're taking, especially if you're using more than one at the same time. This helps prevent drug interactions that can overload the liver. Regular blood tests are also a great way to monitor how your liver is functioning, particularly if you're on long-term treatment. Another key tip is to always follow the prescribed dosages. People often take higher doses thinking it will lead to faster or better results, but this only increases the risk of liver toxicity. Sticking to your doctor's instructions is crucial for liver protection. Healthy lifestyle choices also play a huge role in liver protection. Maintaining a balanced diet rich in fruits and vegetables, avoiding excessive alcohol consumption, and staying hydrated are simple steps that can help your liver work well for a long time. Remember, your liver benefits from rest too, so try to avoid overloading it with processed foods and alcohol. And if you enjoyed this video and want to learn more about taking care of your liver, check out our video on 7 superfruits boosting liver detox and how to eat them. These fruits are a delicious and natural way to help keep your liver healthy.